Over 300 million people worldwide suffer from major depressive disorder, making it the leading cause of disability. Everyone has heard of depression. People use it in their everyday language to describe how a sad movie made them feel or when they get a bad test grade back. But what really is major depressive disorder? Well, according to the DSM-5, in order to be diagnosed with MDD, one must exhibit 5 or more of the following criteria for a 2-week period, with at least one being number 1 or 2. Number 1, depressed mood. Number 2, diminished interest or pleasure. Number 3, significant loss or gain of appetite or weight. Number 4, insomnia or hypersomnia. Number 5, psychomotor agitation or retardation. Number 6, fatigue or loss of energy. Number 7, diminished concentration. Number 8, feelings of worthlessness or guilt. And number 9, recurrent thoughts of death or suicide. These symptoms can persist for several weeks, months, years, or even a whole person's lifetime. MDD can appear at any time in someone's life, but it commonly occurs in adults aged 18 to 25, according to the National Institute of Mental Health. Depression can occur out of nowhere, but there are usually risk factors that are associated with its onset. Research shows that sociodemographic, health, and economic differences play a huge role in depression rates. One study conducted by Dunlop and colleagues compared older Hispanic, African American, and white individuals. The results showed the Hispanic and African American individuals having a significantly higher rate of depression than the white members. However, when the sociodemographic, health, and economic factors were controlled, the rates of all 3 groups were essentially the same, demonstrating that biological factors such as race don't have as large of an impact on depression rates as social factors do. What about the prevalence of MDD in different ages and genders? Well, according to Flesher and Katz, approximately 3% of prepubescent children suffer from MDD. Once they reach puberty, that rate spikes up to 4 to 8%, with the chances of females developing MDD twice as likely as males. But why is this? Why do people develop depression and others don't? Well, there are many factors. Unlike with race, the difference in depression among genders is primarily biological. Although there is no concrete evidence to explain why females develop MDD more than males, it is speculated that it has to do with hormonal fluctuation. However, for the general population, depression can be caused by a multitude of factors. Some of these factors include genetics and heredity, biological factors such as low amounts of serotonin or melatonin in the brain, past experiences or trauma such as abuse, natural disaster, or death, or ongoing stress like relationships and money problems. Pico discusses how one's environment can also affect someone's chances of developing MDD. Among women, their level of education can influence their chances. Those with less education are more likely to develop the disorder. Similarly, among men, their family income plays a role. The lower the family income, the more likely they are to develop the disorder. However, this does not mean that all men with a low family income and all women with less education are bound to develop MDD. It just means that there is a higher chance to develop it among those communities. The type of treatment you receive depends on the severity of your depression. If an individual has mild depression, the psychiatrist will most likely recommend some sort of therapy, such as a cognitive behavioral therapy. For those suffering from moderate depression, antidepressants are recommended for treatment. Antidepressants may be paired with psychotherapy such as CBT to help the patient's depressive symptoms lessen. Those with severe depression who are treatment resistant would go through more invasive efforts such as electroconvulsive therapy, which lasts for an average of 6 to 10 sessions. An interesting new drug therapy is ketamine. Ketamine is a drug most often known for its use as a club drug. However, scientists have been making an effort to develop a new drug to treat treatment-resistant depression that is based on ketamine. An individual taking this new drug would feel the effects after minutes rather than the weeks it takes with regular antidepressants. However, this drug isn't flawless. Although it helps lessen the symptoms of depression, there are a few downsides to it, such as the risk of individuals hallucinating and misusing the drug. Therefore, if this new medication were to be approved by the FDA, clients would receive their medication under clinical supervision to ensure its proper use. Johnson & Johnson have been one company working on perfecting this new drug therapy. After conducting trials in 39 locations for 2 years, they have successfully come up with a new treatment. This treatment includes medically supervised esketamine nasal spray plus a newly initiated oral antidepressant. Results of these studies show a quick and significant improvement with those suffering from treatment-resistant depression, including the elderly, who tend to have a weaker response to treatment. Treatment-resistant depression affects about 30% of those suffering from MDD. It is in hopes that this new drug therapy will help reduce those numbers in time. Major depressive disorder not only comes with emotional tolls, but it can also affect your physical and neurological health. When comparing PET scans of those with major depressive disorder and those without, there is a visible difference between the two. Brains of individuals with MDD have a significantly lower amount of brain activity than those who don't suffer from MDD. In addition to lower brain activity, MDD can cause more long-term effects on the brain. Although it is not a degenerative disease such as Alzheimer's or dementia, it does mimic those diseases in a very minute way. These results come from a study featured in Lancet Psychiatry Journal. A group of 81 participants were split up and had PET scans done. The scans of participants with MDD who haven't received treatment for 10 or more years were compared to those with MDD who haven't received treatment for 9 or less years. The PET scans of those suffering from untreated MDD for 10 or more years had a 29 to 33% volume of the protein TSPO than those who have been untreated for 9 or less years. The protein TSPO is prevalent in Alzheimer's patients. When antidepressants were administered, this yearly increase of TSPO halted. This study shows that the longer one goes without treatment, the more TSPO there is in the individual's brain. Therefore, it is very important for people with MDD to seek help as soon as possible. Because depression presents itself differently throughout cultures, it's important to pay attention to each culture's deviant cultural scripts. According to Dunton, research suggests that culture shapes the way in which lines are drawn between normal and deviant reactions. Where serious distress is understood as a diagnosable medical problem in some cultural contexts, it is recognized as a normal part of being human in others. For example, Western civilization symptoms of depression would be considered the norm for falling in love to Iranians. In addition, the DSM-5 accepts depression due to external events, such as trauma or death in the family. However, to Spaniards, these symptoms would not be considered deviant, and therefore probably wouldn't receive the same treatment as someone with depression. And in Korea, Koreans manifest their depression primarily through somatic symptoms, such as a stomach ache, headache, fatigue, etc. An interesting case study that exhibits the manifestation of depression between cultures is as follows. Yi, a young U.S.-born Hmong woman, is seriously distressed. She is having difficulty sleeping, she has lost her appetite, and she lacks interest in her studies. Yi also says that she has little energy and is having a difficult time balancing school and family obligations. Although she does not spontaneously use emotional terms to describe how she feels, when asked, she agrees that she is unhappy and anxious. All of these symptoms are consistent with DSM-5 criteria for major depressive disorder. And yet, Eve reports other symptoms that are not typically associated with major depression. She describes bodily aches and pains, especially in her stomach and liver. She has become particularly concerned about what other people might think of her, making it hard for her to get along with her family. Finally, she reports that at night, the spirit of a disgruntled ancestor visits her right before she's about to fall asleep. These encounters sap her energy. Although she says that she knows other people who have been visited by spirits, she is nonetheless concerned about experiencing these visits herself. Yi experiences some symptoms that are generally associated with depression in America and other Western cultures, such as the difficulty sleeping and lacking interest. However, the other symptoms, such as the spirits and liver pain, are peculiar to us and would not lead her to a diagnosis of depression, according to the DSM-5. However, in the Hmong culture, which is primarily in China, it is normal for those suffering from depression to experience these odd pains and visits from spirits. Individuals are suffering from MDD all around the world. The problem among depression and the majority of mental illnesses is the stigma surrounding them. Many people don't receive help for their depression due to embarrassment or fear that they are a burden to others. This makes it difficult for individuals with MDD to ask for help. One way to help your loved ones suffering from major depressive disorder is reaching out, providing support, and helping them get proper treatment. Receiving help is the first step to living a healthier and happier lifestyle and creating a better world for all.